Most joint replacements are still working at 20 to 25 years.
Factors such as body weight and the amount of impact activity
can influence the longevity of a replaced joint.
If you have a waterproof bandage over your incision, you can shower every day as soon as you go home,
unless otherwise directed by your surgeon.
At first, keep your shower brief.
And make sure you have a support person nearby to assist you if you become unsteady
or need help getting in and out of the shower.
Gently pat your incision area dry using a separate clean towel to help prevent infection. To help protect against infection, most surgeons recommend that your incision be fully healed before you get into a swimming pool, jacuzzi, or the ocean.
It usually takes at least 4 weeks after surgery before patients can return to swimming and bathing in a tub.
Be careful when you get into a tub because getting down to the ground level and getting back up again can be very difficult.
Patients often ask if it's normal to have pain after joint replacement surgery.
Everyone tolerates pain differently, but you will probably experience at least some soreness or pain.
During your surgery, a local anesthetic is used that can provide pain relief for up to 3 days. As that wears off, you can anticipate slightly more pain.
Your pain will often increase after walking and during your exercises. Elevating your legs, using ice, and oral pain medication will help minimize the pain.
We encourage you to wean off and discontinue the narcotic pain medication as early as possible.
Tylenol is a good alternative.
Limit the use of over-the-counter anti-inflammatory medications such as ibuprofen or naproxen while you're still taking blood-thinning medication, generally for the first 2 to 4 weeks after surgery,
unless it was approved by your surgeon.
A common side effect of any narcotic pain medication is constipation. You will want to take a stool softener to help with this.
You may also speak with your pharmacist if you have severe constipation.
They may recommend other medications like a suppository or an enema.
Try to eat a high-fiber diet and drink plenty of fluids to help minimize constipation.
Do not go more than 2 or 3 days without having a bowel movement before you take medication for constipation.
Nausea is another common side effect of narcotic pain medication. It is helpful to have food in your stomach when you take your pain medicine.
Even a small amount of food like crackers or yogurt will help. You should also stay hydrated by drinking plenty of fluids such as water or sports drinks.
Try to minimize the narcotic pain medication and transition to Tylenol as soon as you are able.
Swelling and some redness is normal after joint replacement surgery.
This will become apparent in the 48 hours following the surgery.
The swelling will follow gravity down your leg and can even result in swelling down to the foot.
Elevating your leg above the level of your heart when you are not walking and using ice packs on your new joint can help to decrease the swelling and pain.
Bruising around the incision is normal after surgery.
After your joint replacement surgery, your surgeon will prescribe a blood thinner.
This will help prevent deep vein thrombosis, which is a blood clot in the leg, but it can also result in bruising.
You may have bruising around the thigh after a knee replacement.
A tourniquet is frequently used during a knee replacement to minimize bleeding during surgery.
This tight band can cause bruising around the thigh. The bruising follows gravity and will travel down the leg and can even reach into the foot or heel.
To drive, you must have stopped using narcotic pain medication. These include medicines such as Percocet, oxycodone, Norco or hydrocodone, and Ultram or Tramadol.
Your reflexes must have rapid response time for you to drive, so you can quickly manage the brake and accelerator in your car.
Patients are typically able to drive 2 to 6 weeks after surgery.
At your first post-op appointment, ask your surgeon for guidance on when you can resume driving.
Before then, if you have outpatient physical therapy or other appointments, you will need to arrange transportation.
Many studies have shown that certain supplements can increase the risk of bleeding.
With that in mind, you will want to hold off on your supplements
until you have completed your blood thinning medication.
This is typically 2 to 4 weeks after your surgery.
Patients often ask if they can hold their pets or even have them sleep with them as they did before surgery.
We recommend that if you have a bandage over the incision, you do not allow pets to lick your bandage or incision area,
Sit on you without your incision covered, or sleep between the sheets with you until your incision is fully healed, which will be several weeks after your surgery.
Taking a daily shower, frequent hand washing, and practicing overall good hygiene will help decrease chance of infection from your pets as well as other sources. Your incision, muscles, and ligaments need time to heal.
You can resume sexual activity when you feel ready.
Generally, most people wait a few weeks after surgery.
If you have questions, discuss this with your surgeon.